Hi, I'm Dr. Jaya Venkataraman. I am a pediatrician. I currently practice in Germantown, but I've been in Collierville for about 6 years. Had my office in Collierville till about 2 years ago. My office address is 3180 Professional Plaza, Suite 111, Germantown, Tennessee. My office number is 901-854-5455. I've been asked to speak on behalf of the Committee for School Start Later. I've been a pediatrician for over 20 years. And so the request for late school start time, it has its genesis in our current understanding of adolescence and the importance of sleep. Insufficient sleep represents one of the most common, important, and potentially remediable health risks in adolescence. What happens during adolescence? At the change of puberty, there's actually a shift in the biological sleep cycle. So it's not entirely an adolescent's fault that they're not able to sleep later. So this altered sleep drive leads to teens needing a longer time to fall asleep. And their sleep hours, however, don't change at all. They're still growing, and it's really essential that they get their sleep so that they can grow optimally. And practically speaking, in today's American teen, the way life is now, their best sleep time is about 11 o'clock if you talk to a teen, which again makes that wake up time at 8 a.m. or later. Most of us with adolescents can relate to this. We used to put our kids to bed at 8:30, they'd fall asleep, and suddenly something happens. You take away their cell phone, and you go back to the room, and they're still awake. And it's not entirely their fault. And I've been a parent experiencing that, thinking, what's going on? You're not sleeping, it's all your fault. And you know it's not, it is partly because of science. Their melatonin secretion happens later. So what does this cause? So 87% of teens with the sleep time not being there are sleep deprived. But if you talk to adults, most adults don't realize that. We think of teens as transition to adulthood, and less than 30% of the adults, the parents, thought their teens were not getting enough sleep. Many of us attribute this to a lazy teenager. He's not getting up. Realistically speaking, if we have a school start time that's around 7, it's like us as adults waking up at 4 o'clock to go to work. So, and what does this result in? The teens are sleep deprived on school days. Then what happens on weekends? They catch up with sleep. They end up sleeping in till noon sometimes. And it definitely helps with the sleep deficit. However, this disrupts the circadian rhythm and ends up leading to problems again on, catching up again on Monday and Tuesday because of this sleep cycle getting disrupted. And numerous studies have been done to look into these issues. This has become a fairly hot topic for us pediatricians. And part of my job as a pediatrician is to counsel my patients to make sure they're eating right, sleeping right, and this almost becomes impossible with the current school start times. I've experienced this as a parent where I've felt really bad about my daughter when she was in Germantown school starting at 7. And the moment she started college, it was a life changer. Everything was so much better, and we realized why. What are the risks? There is an increased risk of obesity. At all ages, short sleepers gained more weight and were 58% more likely to become overweight or obese. I'm sure we all can relate to the time when we don't sleep enough, we keep attacking junk food, and the same thing happens to our teens. There's also increased risk of metabolic dysfunction, much higher risk of type 2 diabetes, which we're seeing an increase in currently. Also, there's a higher risk of high cholesterol issues. The other problem for physical health and safety is an increase in heart-related issues, such as high blood pressure and increased risk of stroke. And we should also remember that problems we experience as adults doesn't suddenly happen when we turn 40 and 50. This is everything, this is how we do things when we're, in our teens, 20s, carrying over. So potentially this can affect a person throughout their adult years as well. There's an increased risk of motor vehicle crashes, and sometimes these effects can be considered as similar to drunk driving. The number of car crashes for teen drivers from 16 to 18 years of age was reduced by about 70% when a school shifted start times from 7:35 to 8:55. And this was done in a very good study, which was done over 3 years of 9,000 students and 8 high schools that were quite in different areas and a very good mix of schools. There's a higher risk of caffeine consumption. I'm sure we all know about kids drinking energy shots. They try to also take someone's Adderall prescription. That's why there's the off-market thing of people trying to sell their medication because of this desperation for trying to stay awake in school. And part of the not having enough sleep also leads to lower level of physical activity and sluggishness. So I've just talked about the physical health and safety. Now there's a big risk to mental health and behavior. Far higher risk of anxiety, depression, and suicidal ideation. I've seen this personally in being in Germantown and seeing schools start before 7 to the new start time. I don't have actual numbers, but I know anecdotally that there's a big difference. I've talked to my teens, and the few minutes extra that they get in the morning for sleep has made a huge difference to how they feel. They take a lot less time to do their homework, so even though in theory the school finishes later, but this doesn't necessarily work out to that exact number. There's poor impulse control, increased risk-taking behaviors, which to start with teens are more vulnerable to. There's increased vulnerability to stress as well. We know this affects academics and school performance. I'm sure if we all got up at 4 a.m. to work every day, we'd probably not do such a good job as if we got a good night's rest, and the same thing applies to our teens. They have a harder time doing work that has more complex tasks. They have a hard time retaining things and recalling. And in the end, this ends up leading to lower academic achievement. And there are many times that kids are just too tired in the morning to get up, so they either go to school late or decide not to go to school altogether. And again, studies have shown that there's a big decrease in tardiness and absenteeism when the school times have changed. The AP recommended in August 2014 very firmly that we should be delaying start times of middle and high school students to combat teen sleep deprivation. We should remember that our foremost priority is for the welfare of our children. We want our children to make the most of high school before they go out into the adult world. And we should be champions for our children so we can reap the benefits many times over as a society. So many schools have done so all over the country, and they're enjoying the benefits. We should also remember sometimes we do things just because it's the way it's done. As time has gone by, we know that we've started to do things differently. No one talks about how expensive seatbelts are, and we don't have an option to have cars with or without seatbelts. It doesn't matter what the cost is. All cars come with seatbelts. If we decide as a community that our priority is for our children first, and we make that as a priority, I'm sure with everyone's ideas, we can make this happen to start school later. We should also remember that young children would be quite okay if even though we don't think of it this way, if we started elementary school earlier. These kids, if you send them to bed at 8 instead of 8:30, they're going to be quite fine with it and still be able to get up So there are many ways, and having an open mind to try to make this change hopefully should make it happen. Thank you.